Currently, we are in the Aquarius age, and right now we are drowning in information while starving for wisdom. What I mean by that is that in today's time, there's so much information on the internet, social media platforms being shared. Uh, People are drowning, right, in a sea of information, and it's hard to navigate what's good health, what's not, what's fake news, what's not, and you have so many different distractions, and it's overwhelming that it makes it very hard to navigate, this library of information that is out here when you're especially looking for proper health, dependent for you and your family, right? So, what I'm going to do as an independent research is help us to navigate the seas based on our movement of water, right? Follow the drip into the drop, and you will find the root cause of many diseases, right? So, um, through the research that I will be presenting, um, will show you where it starts from, and then we can start to follow that, and you can add on information and basically compile. But everything is connected, everything is interconnected, right? So we have to have a start point, right? So this is where I'm going to start with a brief introduction as myself as an independent research scientist, Christopher Harrison, right? I am an independent research scientist whose job is to expand our human knowledge and understanding, right, on human health through water, hydration, and the movement of that, which is energy, as a whole holistic point of view inside the body and out. All right, so it's based on the movement of water, which is energy. Energy moves through water, a medium, right? And we're going to follow the drip. So much of the research I will present will be based on a variety of different fields such as biology, chemistry, physics, and engineering. Much of the data I have collected thus far is from various sources, from research articles and credible sites to well knowledgeable field experts with firsthand experiences. Okay, because as a research scientist, you have to lean on other experts that are in the field that are documenting this research and providing us with this information. So we have to navigate through this in order to provide you, because if you're not in the lab, how do you know exactly what's what, right? And that's where a lot of the information is misconstrued a lot of times now at this point in time, because everybody's passing on, we're playing the game of telephone where nobody has a direct line to, the lab scientists, the field research, the people that are actually doing the work, right? So, it's he say, she say, that type of ordeal. So I'm gonna be connecting you directly to the sources of this information, right, and allow you to make your own outcomes. Okay, so um, like I said, I'll be uh, analyzing much of the data with theories and spiritual philosophies. And as an independent research scientist, I'll be sharing. It's pretty rare, right? Based on the information that I'll be sharing, because um, large institutions, like I said, usually back research scientists, or they're backed by grants or big private companies who can influence the results, right? So, and they normally get paid either a 12-month salary or some combination of salary and grants, right, in order to take care of their living costs. Okay, so once the grant money and those things starts to run out, it starts to affect the research after a while. So what I've been doing over the past 7 years, I have been utilizing. I bought a water company, Family Springs, to help fund this research on navigating these seas, right, through for holistic health of the mind and physical body of the individuals from within our lower economic areas to which I've come up out of, black communities and small businesses. This level of trickle down economics will expose how everything is interconnected and how the environment plays a large role in the human nature of healthy cells or not, right? So, based on our distribution of our bottled water, it remains independent, right? So, from any major chain affiliations or distributions, right? So, based on our concepts and our philosophies, our theories, and the results of information that we'll be sharing with you guys, uh, we're not worried about somebody's pulling our bottled water off the shelves because they don't like what we have to say. Or we may have rubbed some people the wrong way with the information that that we will be providing. Okay, so we would appreciate it if you could continue to support us. If you respect the information that we're sharing and what we're doing by continuing to buy the Family Springs bottled water wherever its water is sold, joining our subscription, familysprings.net, and following the drip into any of our local affiliation restaurants and purchasing any of our affiliate products. All right, that will help to continue to fund the research that we will be providing. And this is just the start. Okay, so water is a carrier of information, right? And it unites many families, communities as a builder of economics. And our job is to provide you with the best information, connecting you directly to the source, right? So when you follow the drip, you'll see where it drops, and you will find the roots of the health epidemic that is, running the world at this point. So, for a better tomorrow, let's address the issues of the American way, healthcare in America. So, what we're going to do is start off by Googling, right? You can start off by Googling the cost of healthcare spending 2023, as most recent as last year, right? The information provided by the Peter G. Peterson Foundation is a nonpartisan organization dedicated to addressing America's long term physical challenges to ensure a better economic future. Okay, so this states that the United States spends nearly 2 times the average of similar wealth countries with no better outcomes than these, countries, and in some cases worse in areas such as life expectancy, infant mortality, and diabetes. One of the underlying factors is that consumers have no sensitivity to their costs because their employers and health plans often cover a large share of their costs, so they are unaware of the information required to assess quality and cost, which also creates a gap between small businesses and big companies that can afford to offer health care to employees, which draws away from the pool of resources that can help the economic growth of small businesses, right? So what I mean by that, if you listen and you talk, there's another reason, right? And another reason is that the providers generally operate under a fee for service, right? And that's a model which means that they are compensated based on the volume of patients they see versus their services of their value of care. Overall, the total cost of healthcare, including all private and public spending, are anticipated to rise from $4.7 trillion in 2023 to $7.2 trillion in 2031, according to the Centers for Medicare and Medicaid Services. That's an average of 5.5%. It says right down here, right? So um, we understand that this is a growing business that has no end foreseeable in the foreseeable future. Okay. So here you can see the drastic growth in spending by state, local, and the differences in federal funds used to assist since 1970 to 2019. Okay, so on this left side, you can actually see how this chart continues to rise, right, drastically from this 1970 period, dating to 2019. Okay, so it's a few years ago. All right, so we understand that this growth is, expedition, you know, is drastic, right? If you look right here on the right side of the chart, just below this highlighted area, right, it'll tell you right here that the projected spending of the healthcare costs will grow faster than the economy from 18% in 2023 to 20% in 2031, right? So it's just talking about the drastic growth, right, of many people that is going to be in need of health problems, right? So there's a lot of information being shared, right, statistically on how important this market is and how it's driving the economy. Okay, so the healthcare costs in the United States have increased drastically over the past several decades, and since the early 1960s is where you will begin to notice the paradigm shift on a micro and macro scale, which will lead us to the current symptoms of today and the root cause of disease. So once again, from this 1960 area, these 1960s is going to be very important to all the data that I actually provide, right, moving forward. So just make sure that you pay attention to this 1960s area. This right here is dating to 1962, and you see the incline, right, all the way to about 2019, right, and then you can see the projected growth, and it's steady, constantly growing. Okay, so with that being said, Google's our friend. All right, so we want to encourage you guys to get on the Google and start to look, right, and find out most of this information that's out here provided, and start to change the algorithm, right? So a public health, you know, you my fault. Just Google relationship between doctors and pharmaceutical companies, right? So when you do that, this is what popped up for me. You have doctors that make money from Adderall, right? So it talks right here between 2013 to 2018, almost 592,000 payments that total more than 20 million were made to physicians, right, who prescribe stimulants, right? And this article is dating back from 2020. Okay, all right. So down here it talks about why do doctors push medications. They always talk about doctors are your biggest drug dealers, right? One of the reasons is due to many incentives offered by medical devices and pharmaceutical companies. So we're going to really pull back these layers and start to show you exactly what this looks like. Okay, and here, which is a big thing, especially with cancer right now, do doctors get paid for chemotherapy, right? And down here, it talks about the oncologists in private practice typically make 2/3 of their practice revenue from the chemotherapy concessions. Okay, so this is not saying doctors should not get paid, but if they're getting paid off the products that they're endorsing, right, it behooves them to actually push it onto the customers to actually use it. Now, whether they believe in it or not, I'm sure that's unethical and there's laws to that, but it's kind of hard to draw that line, right? So we're going to literally start to pull that back, right? So based on this research right here, although comparison is, hold up, my fault, and make sure that I got you right here because this is a public health review article published January 11th, 2023, all right, by Frontiers in Public Health, who are the third most cited source with over 687 million articles downloaded last year in 2023. All right, here it discusses the relationship of doctors and pharmaceutical companies' influence on the public and the medical healthcare system. The payments from pharmaceutical companies to physicians are most common and can very much influence the behavior of the prescribing physician. Okay, so although compensation is illegal, it does happen in more ways than one, and from a cash or consulting services, lectures or travel accommodations, etc. And there's also non-cash forms such as meals, gifts, stocks, and licenses. About 90% of pharmaceutical costs are allocated to physicians and other prescribers. The industry payments to physicians and teaching hospitals in the United States, excluding the amount for scientific research funding, amount to 3.6 billion in 2019, and this is before COVID data, right? So almost half of the physicians receive annual payments from the industry, according to the findings of systematic review lows in the middle income countries, and most common in showing a financial relationship with physicians and the pharmaceutical industry. Okay, so you see, underlining most of this, what the information that is shown here, right? But as we go to the next slide, you can just really kind of look through this, and I highlighted some of the major points in this area as well, where it states, United States showed a 10% increase in pharmaceutical industry's payments to physicians is associated with 1.3% increase in medical costs and a 1.8% increase in drug costs. The argument for the physicians is that pharmaceutical companies need physicians to test products, right, to use in clinical trials. It's also stated that, humanity owes a great deal to the corporations, right? Of course, for the pharmaceutical companies and physicians for the life-saving drugs and surgical devices. So if they did not have, you know, test dummies, for lack of a better word, crash dummies, for lack of a better word, it would not be able to advance this medicine to the majority of people. But I want you to hold that thought as we continue to peel back more layers of this. Continue to hold that thought. So, not saying that they're bad. Once again, we're saying that there's a need, but is it regulated, right? And how is it regulated, and who's paying for this, right? Largely, right? We already know it's the insurance companies, and we're detached from it because the insurance companies to which we pay and the taxes we pay literally cover that cost. So it, we're paying multiple times, for the same payment, and it doesn't seem like it, right? But let's continue to go pull it back, right? So it's not openly discussed or visibly seen by patients nor the public. There's a cost associated with going to the doctors that may be unseen, which is why I, as well as many other health, wellness, and holistic practices, advocate for individuals to take control of their own health, right? You're your first doctor. So if you go to the hospital and I'm saying misdiagnose yourself, if you don't know your own symptoms, right, or you can't explain your own symptoms and what you're going through and what you're doing and what you're not doing, then how can the doctor actually help you? Or they may prescribe you the wrong medication right off bat, right? So you have to understand that taking your health is a major priority, right? By hydrating, and making sure you're eating the right things and making sure you're exercising, taking care of the basic necessities first. So then when you go ahead and go into the doctor, you can go and say, look, I'm taking care of this, I'm taking care of that. What seems to be the issues, and can we work from here and use and build upon and expand upon their knowledge by combining it with what your own knowledge is. But you have to be an informed patient by going in there. Okay, so here it talks about how pharmaceutical companies price their drugs. Is just major because the price of pharmaceutical drugs remains unregulated. So because it's unregulated, it leaves huge profit margins for drug makers to price gouge the uninformed public, which in turn allows pharmaceutical companies to increase their drug prices beyond inflation rates regardless of the demand. The pharmaceutical companies also can hold a patent for over a decade without any competition, right? So they can continue to stretch the market out and price gouge the people, well over the cost of what it takes to take it to market, okay? And able to capitalize off of it for a decade before there's any competition in the market, right? So think of how many people are literally benefiting off of this tax and this insurance money that we have to pay for, okay? And our kids have to pay for. So this is where I want you to really kind of take a look at, right? Because now we're going to talk about our drugs do not work on most patients. And this is by a senior executive, okay, of GlaxoSmithKline, right? And this is an outdated, this is back in 2003, right? So now, since then, this Dr. Alan Rose, he's passed away. I think it was 2016 he passed away. But I want you to take note of what he said, because this is what he said and it's very important, right? So I highlighted most of it, but a senior executive of Britain's biggest drug company flat out admitted that most prescription medications do not work on most people who take them. Dr. Alan Rose's worldwide vice president of GlaxoSmithKline said that fewer than half of the patients prescribed some of the most expensive drugs actually derive any benefits from them. Dr. Rosa says that often doctors use the trial and error approach, which says that if one drug does not work, there is always another one or even a combination of them. So how many people have a back pain or a migraine or whatever and get a few different drugs, right, in order to prescribe? Not quite sure what it is, but we're going to give you one for this, and one for that. Okay, so they're literally kind of piecing together some type of thing to, you know, subdue, the whatever this symptom is. Okay, so drugs for Alzheimer's disease work in fewer than 1 in 3 patients, whereas those with cancer are only effective in a quarter of patients. And drugs for migraines and osteoporosis work in half of the patients. Dr. Roses also follows up and says that the main reason most drugs don't work is because the recipient carries genes that interferes with the medicine in some ways, right? So they literally have to already break down and shut down your immune system in order for you to take drugs, right? Because it has to bypass the defense. Because if it's foreign to your body's going to fight whatever is being injected into it. Make sense? All right. So your body has a natural defense system. But the vast majority of drugs, more than 90%, only work in 30% or 50% of people. Dr. Roses was also quoted for saying that I wouldn't say that most drugs don't work. I would say that most drugs only work in 30 to 50% of patients. So now, if you are interested in doing some of your own research, you can check out this Death by Medicine written by Gary Knoll, PhD, and a few other medical doctors listed on this cover, right? And you can find it on Amazon. Um, I believe it's a documentary too that you have to look up as well, though. But it's information that's out there that's constantly stating the same thing. All right, so Americans are currently being prescribed pharmaceuticals at a higher rate than ever, according to the research done by the Henry J. Kaiser Family Foundation, who is an independent source of health policy and research. Polling and news since 1948 says in 2016 there were a little over 4 billion drug prescriptions filled at retail pharmacies in the United States. Okay, so that's like 13 prescriptions for every single American. Okay, 2016. All right, so once again, we want you to Google's our friend. Google how many pharmaceutical drug prescriptions filled at retail pharmacies in the U.S. All right, have it right up here. Filled at retail pharmacies in the U.S. Okay, so according to the U.S. Department of Health and Human Services, more than 131 million people, which equates to 66% of adults in the U.S., prescription medication, and of that 7.6 billion retail prescription drugs filled by pharmacies in 2019, 44% was paid by Medicare and Medicaid health coverage, which furthermore led to the fact that Americans are numb to the pain of the economic financial burden this health care insurance system has been burdening the people and stifling the growth of our future generation, right? So Medicaid is jointly funded through the federal and state dollars, right? Which you can see here, right? So this is literally telling you the information, right? You know, from the independent source of health policies and research, polling, and news. Okay, so it's literally going to break down this information, and it's telling you within, these few short years, it went from 13 prescriptions for every single American in 2016 to approximately 19 prescriptions for every American filled in 2020 alone. Okay, 2020 alone. So, just breaking down this, you can literally see where our money is going to, as far as this is, you know, the total revenue, right? 887 billion dollars, right? Basically total 888 billion in 2021. And then you can see how the breakdown from payroll taxes and general revenue taxes, okay? Where a large amount of that money is going into Medicare in order to pay for the insurances for, these prescription drugs. Okay. But we don't really notice it because the businesses take care of that, right? And we just pay this copay. All right. And we pay it through the taxes, right? So let's look up iatrogenic disease. Okay. Google iatrogenic disease. It's illness and death caused by medical systems itself. Very important. Let's break it down. Comes from the Greek language iatros, which means doctor or healer, and genic, which means as a result of. So as a result of the doctor together means as a result of the doctor, iatrogenic. Comes from pharmaceutical drugs, hospital infection, batch surgeries, etc. Iatrogenic diseases is the leading cause of death. According to the CDC, the top four leading causes of death is accidents, unintentional injuries, which can vary, vary from user or operator, errors to physician's assistant's error. There's no specifications as it remains here. Only this list just under most recent COVID-19, cancer, and the heart disease, right? So COVID-19 as of most recently, right? So before COVID-19, this was number 3, accidents, and it says accidents, unintentional injuries. So yeah, that can mean car accidents, other types of unintentional injuries that happen, right? But it also means accidents that happens, within care of the physician, right? So they basically combine all these things, and it makes it very hard and to actually peel out that information because it's categorized all in one. But if you look, you get a lot of research for heart disease, you get a lot of funding for cancer, right? And COVID was a huge thing, right? But just underneath that, you get something that you don't even hear. So they skip right over accidents, right? And go straight to stroke, chronic lower respiratory disease, Alzheimer's disease. You hear all these other things, but you don't hear anything about the accidents, right? So let's go here. We're familiar with Johns Hopkins, right? Medicine. Don't take my word, right? Once again, let's use Johns Hopkins as a credible source that reports study suggests medical errors now third leading cause of death in the US. Now, I must state that the release date of this information was May 2016, right? So we like, yeah, some of the information could have changed since then, all right? So, but we're going to stay with what information we have at this current time, right? So, over the last 8 year period, John Hopkins patient safety experts analyzed the medical death rate data, calculating it to more than 250,000 deaths per year that are due to medical errors in the US. The team at Johns Hopkins says that the CDC's way of collecting national health statistics fails to classify medical errors separately on the death certificates. Okay, so it further on goes to say Martin McCary, MD, who's a professor at Johns Hopkins University School of Medicine and an authority on health reform, states that incident rates for deaths directly attributed to medical care gone awry haven't been recognized in any standardized method for collecting national statistics, and the medical coding system was designed to maximize billing for physicians' services, not to collect national health statistics, which should be the most important thing. But they literally put the wealth in front of the health, right? So they're really looking to maximize the billing to the patient versus statistics on making sure it gets right and gets done right, okay? So during their study, the researchers examined four separate studies that analyzed medical death rate data from 2000 to 2008, including one of the U.S. Departments of Health and Human Services, Office of the Inspector General, and the Agency for Healthcare Research and Quality. By using the hospital admission rates from 2013, they extrapolated that based on the total 35,416,020 hospitalizations, 251,454 deaths stemmed from a medical error, which equals to 9.5% of all deaths each year in the US. So that can be a large percent or it cannot, depending on how you want to look at it, but it's 9.5%, right, of that total number. Okay, so you can say, what's that, casualties of war, right? Okay, so listen closely, right, to this point made by Dr. Marquet, top ranked causes of death as reported by the CDC informs our country's research funding and public health priorities. And right now we can all see what diseases are going all diseases are getting the most attention in marketing, cancer and heart disease, right? They're getting the most marketing. But since medical errors don't appear on the list of problems, it does not get the proper funding and attention it rightfully deserves. Lastly, with all the important facts and information stated, it does not go without saying that the medical errors are not due to inherently bad doctors, but represents a systemic problem with poor coordinated care, fragmented insurance networks, the absence or under use of safety nets and other protocols, in addition to unwarranted variations in physicians' practice patterns that lacks accountability. Okay, so we're going to just stop there, but this is the start, right, of understanding the root cause of disease, right? Because we have to understand that the environment is literally dictating the nature of how things are driven within this country. All right. So remember and keep that in mind for the 1960s and moving all the way up to current day, and a lot of the healthcare problems that we're facing today, and the constant drive of the economic system, and why we're constantly in this depression and this stress and all the things that are causing the root cause of disease. Yeah, people are living longer, but they're living longer with ailments. All right, so let's go ahead and see how we're going to be able to continue to put this together. This will be to be continued. All right, so make sure that you continue to follow the drip, purchase the Family Springs water, continue to fund our researchers. We're not asking you just to donate blindly, but we're looking to give you something back by hydrating you with natural spring water resources. As you continue to pour into us, we continue to nourish you and hydrate you. All right, and that's a part of our Waternomics cycle. Peace and love. The fight for balance continues inside the body and out. Following up, no man can enter into a strong man's house and spoil his goods, except he will first bind the strong man and then spoil his house.